Thank you for staying with us. Our next guest is Ilia Rolon, the Director of Strategic Planning for Cal Optima, right here in Orange County. So, welcome, Ilia.
Thank you.
And so, one of the things that we understand quite a bit about is Medicare. Medicare is for people 65 and over, and under the Affordable Care Act, it pretty much stays the same, except that, again, the preventive medicine, the annual checkup, there's no cost to that.
Correct.
But then we have another issue called Medi-Cal over here in California. And that's also going to be expanded with most of the money coming from the federal government under this Affordable Care Act. And you know all about that. So we want to get some information from you for those people who have been using Medi-Cal, or maybe those people who haven't been eligible but now may be eligible for it. What are the new restrictions, the new additions? What is Medi-Cal and how will it change starting 2014 in January?
Well, Medi-Cal is a program for low-income individuals, and that's defined as of January 1st of 2014. That's going to be defined as anybody whose income is below 138% of the federal poverty level. So, for example, somebody, an individual who makes about $15,800 or less might qualify for Medi-Cal, provided that they are a legal resident that has been in the United States for at least 5 years.
So the federal poverty rate is around $15,000 right now. But let's say we had the same federal poverty rate in January of 2014. So right now, a Medi-Cal person would have to make about under $15,000, but we're going to bump that number a little bit higher come January. So maybe someone who makes $16,500 or something like that may qualify with the new 38% added onto it. Is that correct?
That's about right. And that's an important thing too, because one of the other things that the expansion does is that previously, if you were an adult who did not have dependent children, you can qualify for Medi-Cal. What the Affordable Care Act has done is that it has opened the doors to coverage to people whose income is below 138% of the federal poverty level, and they don't have to have dependent children to qualify.
Super. I think that's incredibly important for people to understand. Before, in order to get Medi-Cal, it was really about kids.
Exactly.
Attached to an adult if an adult was able to qualify. But now individuals, adults, will be able to qualify as long as they make under 138% of the federal poverty level.
That's correct.
Great. So how do they sign up? What do they do? I mean, where do these new people, they want to know, where do I go? How do I do this?
Right. Well, there are a couple of good resources to point out. Covered California is a great resource. It's got a website calculator that you can use to determine what you might be eligible for. So, for example, if you think you might qualify for Medi-Cal, there will be a telephone number to call that you can use to get connected with your local agency that can screen you and get you enrolled.
So if I go to the website, coveredcalifornia.com, and I think maybe I qualify for Medi-Cal, I don't really know, and I go in, I put my information, they sort of have a cheat sheet, a little worksheet, and then they'll say, hey, yeah, we think you're going to fall into that starting January of 2014, so here's the numbers or here's the place where you would go and you'd find out more about that.
Exactly.
Or that worksheet might say, it's going to depend on what the federal poverty rate really is decided, that exact number come January, so hold your horses and just wait and see. Or it might say, you know what, you really make too much and you're going to need to either get it from your employer or you're going to need to get it from Covered California.
That's exactly right.
So what about the people who are already on Medi-Cal? Are they going to get impacted? I mean, if we're going to have like a ton more people eligible for Medi-Cal, what's going to happen? Because are there going to be less doctors, more doctors? What have we done? You would know about this.
Well, for example, CalOptima is the agency that administers Medi-Cal in Orange County. And we're anticipating that about 80,000 more people will be eligible for Medi-Cal with these new guidelines. But we know too that our provider network right now can take up to 300,000 more individuals. It's not a precise estimate. It's difficult sometimes to make these assessments because, of course, it depends on individuals, providers, capacity to take on, and willingness to take on more patients.
But you think you have capacity right now
We
in
do.
your system as really sort of like the broker of Medi-Cal for all of Orange County. You
Correct.
believe in your system you have enough capacity to take on these 80,000 new people that in Orange County will be eligible to get on Medi-Cal.
We do, Loretta, yes.
Great. So here's my question. What if I qualify for Medi-Cal, but I'm too lazy to sign up, or, is it still a mandate for me to go and sign up? What happens if I don't? What happens if I didn't know? How long do I have? Am I going to get in trouble? What do I need to know if I think I'm either in the Medi-Cal program now or I'm going to qualify under the new guidelines for that program?
Well, first, it's good to point out that having coverage is a very good idea. We know that people who have coverage tend to be healthier. Having that access to preventive care, if something does happen with your health that's unanticipated, having that uninterrupted access to care makes people healthier. And so first I would just encourage people to, get covered. But secondly, I just wanted to point out that yes, there is an individual mandate for coverage. There's a penalty applied if you don't get coverage. Some folks will get waivers because they are, economically it's just not feasible for them to get coverage, and so they'll be exempt from those penalties. But I think it's also important to point out that when you don't have coverage, the impact to your finances can really be severe.
So what you're saying to me is, if you're a resident of the United States for over 5 years or a citizen, you are going to need to be covered.
Yes.
And if you think you make 138% or less of the federal poverty rate, that might be 18,000, might be something like that. Medi-Cal is where you would probably get your health care. If you make more than that, Covered California is probably where you're going to go get your health care if your own business, your own employer is not providing it. So again, if one goes into coveredcalifornia.com, one can work on that
Get
little
the information.
worksheet. They have it up and running starting right around now. And people can actually join, or that is get an insurance policy or join Medi-Cal starting October 1st of this year. And it doesn't begin to cover until January of 2014.
That is correct, yes.
Okay, and it doesn't matter whether you had pre-existing conditions or anything else, away you go. Just get yourself covered, ask questions, call CalOptima, call this Congresswoman's office, go into coveredcalifornia.com. You need to do something. So thank you so much for being with us today.
My pleasure.
I really appreciate it.
My pleasure.
Up next, we welcome back Georgina Maldonado to tell us about how the Affordable Care Act is going to impact small businesses. If you are running your own shop or thinking about starting a business, you'll want to stick around for this.